Doctors and professors at OHSU are trying to help make it easier for COVID-19 survivors to move forward with medical procedures they may need in the future. A team at OHSU has published new protocols intended to help understand when a COVID-19 survivor might be ready for an elective surgery. Fox 12's Drew Reeves spoke with one of the researchers today.
Studies are still being done about the long-term effects of COVID-19, but OHSU believes that several doctors there have authored the first protocols in preparing those COVID-19 survivors for elective surgeries. These protocols have been months in the making. Doctors say they spent a dedicated 7 months on this research, and it will only continue from here. Publishers of this research say this is to help people slow down and make sure that a COVID-19 survivor is medically ready for surgery. They say this is important because COVID can affect the body in so many different ways, and it is nothing like other respiratory infections.
We're learning that COVID has affected so many different organs in the body that we want to make sure that we know what that damage might have been before a surgery. Did it affect your kidneys? Did it affect your heart? Did it affect your liver? Did it increase your risk of forming abnormal blood clots?
Avitala Oglasser has been working on these protocols since Memorial Day. She says before any survivor is ready for an elective surgery, the waiting period needs to be at least a month since having COVID for people with very little symptoms. She said that's closer to 2 months if the symptoms were more severe. She also says doctors need to ask a lot of questions about what a patient's exact symptoms were. There also needs to be more tests run, like blood work and possibly more x-rays. She says the research only continues from here to make sure they're still on the right track. And doctors believe these protocols will be very useful as we continue to learn more about the COVID-19 virus. Reporting in Salem, Drew Reeves, Fox 12 Oregon.